Fantastic. I'll hand over to you two now then to introduce the session.
Thank you. So hi everyone. Thank you so much for joining our showcase session today on budget holder training, making finance fun. So my name's Lucy and I'm with Ali today. We're both finance business partners from Lancashire and South Cumbria NHS Foundation Trust, which is a community and mental health trust, obviously in Lancashire and South Cumbria. So we're just going to talk to you today around how we've approached our budget holder training in the last couple of years with a view to making it more fun and engaging for our budget holders. So if we just go to the next slide, please, Ali. So this is what we're going to cover in the session today, but I suppose just to sort of set the scene around this, we changed our style of delivery in the way we do our training. We felt that there was maybe a little bit of a lack of engagement from our budget holders, and we just wanted to make it more enjoyable for all of those that require that training. Due to the deteriorating financial position, it was more important than ever before that senior managers understand their financial position and have an understanding of how they can influence the trust's overall position as well. So this specific session that we're going to run through today and what we delivered was aimed more at our kind of director of ops and associate director of ops level. But a lot of the techniques and the things that we kind of use as part of this session could definitely be used at maybe service manager or team leader level. But obviously maybe you would just change the content of the session. So what we're going to cover today, obviously we've done the introduction. We're going to do a little icebreaker with all of you just to show you that training and these sort of sessions can be fun. Then we're going to go through the icebreaker that we delivered on the day of the training. We're going to cover flow of funding, budget setting and forecasting, understanding the cost of care, financial governance, efficiencies, and then we'll leave some time for questions at the end. So just to kind of point out, this session was delivered face to face. So where possible, we do try and deliver our finance training face to face now, as we just feel we get a much better response and people are generally a lot more engaged. So I'm going to pass over to Ali now just to kind of do a little bit of an icebreaker for this session.
Hiya, I'm Ali Bailey. I'm the finance business partner for transformation at LSCFT, and yeah, hopefully we can make finance fun for you. We shall see. So we thought we'd start with a little icebreaker, which hopefully will work, but due to the numbers, there's quite a few of you, but we'll see. We'll give it a go. What I'd ask you to do, if you don't mind, and hopefully we won't crash it, if you could all put your cameras on to start. What we're going to do is, if you could ask you a few questions, if you think the answer to the question is higher, then if you raise your hand, and if you think it's lower, just sit tight. If you get the question wrong, then we'll ask you to turn your cameras off. So then hopefully at the end, there'll either be just one winner, 50 winners, who knows, we'll just see how it goes. But we'll make a start. So yeah, just to reiterate, raise your hand if you think it's higher. So first question. So NHS England's budget in 22-23 was 147.8 billion. Do you think the budget for 23-24 was higher or lower? So raise your hands if you think it's higher. Oh, it's going up.
Okay, so the answer to question one was that it was higher. It increased to around 160 billion. So if you got that right, keep your camera on. If you got the answer wrong, turn your cameras off and you can all put your hands down.
Right, second question. The average cost of a GP appointment is £30. Is the average cost of an A&E visit higher or lower? If you think it's higher, raise your hand. If you think it's lower, do nothing.
Okay, so the answer was higher. It's around £77. So if you got the answer right, keep your cameras on. If you got the answer wrong, turn your cameras off. And you can all lower your hands again.
So the NHS spends approximately 10 billion annually on mental health services. Is the annual spend on cancer services higher or lower than 10 billion?
Okay, again, the answer was higher. We spend more on cancer services. That's estimated at around 13 billion. So again, if you got the answer right, keep your cameras on. Answer wrong, turn your cameras off and lower your hands.
Next, the cost of a hip replacement is around £6,000. Is the cost of a knee replacement higher or lower?
Okay, the answer is lower, and it's roughly £5,500 for a knee replacement. So a knee replacement is lower than a hip replacement. If you got the answer right, keep your cameras on. Answer's wrong, turn your cameras off.
The NHS employs around 1.4 million people. Is the number of people employed by the UK's education sector higher or lower? Not that many hands going up for this one.
Okay, according to this quiz, the answer is higher. So
Ooh.
apparently more people are employed by the UK's education sector than the health sector. So if you got it right, keep your camera on. If you got it wrong, turn your cameras off.
Should be dwindling the numbers down now. There wasn't many hands up for that one.
Yeah.
The NHS spends around 1.3 billion annually on agency staff. Is the spend on permanent nursing staff higher or lower?
And the answer is higher. So we spend more on permanent nursing staff than we do on agency staff annually.
The NHS spends 1.3 billion annually on agency staff. Is the spend on permanent? Oh, it's the same one.
Sorry.
All right, never mind. Missed that when doing the slides. Question 8, last one. The average cost of a hospital bed per day is £400. Is the cost of an ICU bed per day higher or lower?
And the answer is higher. That can exceed £1,500 for an ICU bed. So that's the end of our quiz. I'm not sure how many.
Let's have a look how many people have got
It's
the
quite
cameras
hard
on.
to tell when there's so many of you, but I can definitely see a couple.
I'm going to go on gallery view. Oh wait, together view, together mode. Where are we? Who's got the cameras on? Oh, we've not many.
3.
3. Well done, guys.
Well done.
Nothing. You've won nothing. But well done.
So yeah, hopefully that's just give you kind of one idea for an icebreaker that you could do. And obviously these sorts of questions you can make relevant to your own trust. So if we just move on to the next slide, just to sort of set the scene for the session that we did on the day, we gave our directors of ops and our associate directors of ops the objectives for the session beforehand. We also sent out a survey of things that they would like to see as part of the session, and any areas of kind of things that they maybe struggle with. We also set some pre-work, which included watching a national funding flows video and a couple of the HFMA modules. So an overview of NHS finance, the challenges and future of the NHS, and we also asked them to read the most recent board report. And then throughout the day, we also asked them to think about supplementary finance sessions that they would like to see in the future, how they feel how finance can help them, and also what they think would be useful for the next session that we were going to be delivering to the service managers. So we kind of had post-it notes on the wall throughout the day, different flip charts where they could go and write this information. Then on the day of the training, we always start with an icebreaker. So next slide, please, Ali. So again, this probably took about 10 minutes, and we did 2 icebreakers. So it was a big group of people, maybe around 6 people per table. So the first one was a numbers round. So we had on each table numbers kind of cut out on little pieces of paper. So some of them might have been percentages, some of them might have been really, really high numbers, some of them might be lower numbers. And we displayed maybe 10 questions. on the screen and handed out a piece of paper with the 10 questions, and they had to match the number to the correct question. So all these questions were relevant to our organisation. So it might be, how much do you think our trust spends on agency staff per year, or how much income do we receive, or how many invoices do we process each year, that sort of thing. So that was just like a quick question, and they had to match the numbers to the questions. Again, all relevant to our organisation. And then similar to the numbers round, we did the same for the word round. So again, matching the correct answer to the correct question. So again, more around kind of definitions, what does EIP stand for, or that sort of thing. So yeah, that was what we did for the icebreaker, and we felt that was really good because it brought a lot of energy into the room. It was encouraging them to work together and have discussions, rather than it sort of being a solo effort. Just to add as well, we awarded points throughout the day. So the tables could accumulate points throughout the day as we went through the different activities, and then we had kind of little prizes at the end of the day, chocolates, that sort of thing. So that was what we did as our icebreaker on the day. But there's so many different icebreakers you can do, and obviously we've just done a higher and lower one then. But yeah, that's what we did on the day. So if you want to just hand back over to Ali to talk to you about the next bit.
Yeah, so the first session we did was around the flow of funding. We wanted managers to understand how funding flows in the NHS and to LSCFT. We'd given them some pre-work, which consisted of watching the National Funding Flows video and completing a couple of the HFMA modules. So we asked them to complete one that was called an overview of NHS finance, and also another one that was called the challenges and futures of the NHS, because we just wanted to put into context how funds are apportioned around the system. So what we did in this session, to try and make things a little less dry, we explored the flow of funding using coloured coins, so that represented money. Each table was given an A3 piece of paper, which looked like the slide that you're looking at now, and they were given an allocation of coins. So for the first exercise, they were asked to decide how much funding was allocated to different services within the LSC, Lancashire and South Cumbria ICB footprint. To try and encourage quick thinking, we did sort of like a countdown style timer as well. So that was quite interesting, quite fun. For the second one, we asked them to allocate how much of LSCFT's income came from different sources. So we awarded points for good guesses because we realised that they weren't going to probably get it exactly right, and bonus points for correct answers. And then we did a third one, which was tasked to ask them to guess how the trust budget is allocated across the different cost groups. We used a cost group shown in our service line reporting system to make it relevant for them. And then next, it's over to Lucy.
So after we did the flow of funding, we moved on to sort of budget setting and forecasting. So we did have to do a bit of an explanation around budget setting and forecasting in our own organisation. Obviously, that will differ from each organisation, but also outlining our responsibilities and what we needed to do for planning purposes, etc. So after we'd sort of given a brief overview of that, we asked them just to do another tabletop exercise, which was looking at how managers can influence the process. So the aim was to get them discussing and realising what their impact can be on the trust financial position from the day-to-day decisions that they make. With kind of the current climate as it is, focusing on day-to-day decisions has a huge impact to the bottom line. So we asked them to talk about how they feel they could influence the process. So things we were looking for was around non-pay, staff spend, following recruitment and governance processes correctly, contract negotiation, efficiencies, and things like that. And then if we just move on to the next slide, this is where we moved on to the cost of care. So we did have our costing accountant with us as well when we do this session, and she does this part of the training. So we do an overview of costing in the NHS, and then we play this video from Future Focus Finance, which is around costing in the NHS. We then did a quick fire quiz based on the video. So we asked questions based on the video, and then each table first put the hand up and answer it correctly got the points. So again, just to bring everyone back in the room after watching the video. We did a little bit more on kind of SLR and PLIX as well, and they do talk around that. But then what we did as the exercise to try and make it a little bit more engaging this time is we presented them. Each table had a couple of big sheets of some SLR data for teams that were all comparable within the organisation that looked like this. So all the teams that you can see on here, they're all comparable. So we asked them, obviously it didn't have any of these highlighted areas, but we asked them to look at this sample data and just try and understand where there might be some discrepancies. If they're all comparable, why did they look so different? So things that we'd be looking for is kind of cost per contact, activity levels differing so much, net surplus deficit, why the direct cost might be so different. So we asked them to look at this as a table and highlight any areas that they thought looked different. And I think this was a really good exercise because it was probably something that they're not used to doing as much. And the conversations that fell out of this were really interesting, and people did seem really engaged with this activity. So that was kind of a bit of an overview of what we did around costing. And then moving on to the next section of the training.
Yeah, so this was around our governance processes around business cases, really. So we've recently brought in a new governance process for investment decisions and business cases. So we spent some time running through the templates and gaining some valuable feedback from the senior managers whilst we had them in the room. And to try and get them to remember the new finance governance process, we decided to play a game of beer pong, but without the beer. Not quite so interesting. So the process, our governance process, had 10 steps in it. So each table had 10 steps in an envelope. But before they could have one of the steps, they had to get a ball in the cup. So every time they got a ball in the cup, they got another piece of the puzzle. And then once they've got all 10 steps, they then had to put them in the right order. And the first table to get them in the right order won a prize and 1 point. We then did an interactive quiz on the financial governance. It was multiple choice, but we then stuck some little daft challenges in the middle of it just to earn them some extra points. So we did things like we said the first team to recite the alphabet backwards, the quickest, wins a point. We did the first team to stand in a line in high order facing the back of the room wins a point. First team to balance a cup on the head wins a point. So it was funny, and the energy in the room was really good, and they really enjoyed it. So, and hopefully they learned something too about the process, and it stuck a bit more. The next thing we did was we did a session on efficiencies, and we asked them, why do we need to make efficiencies? Again, this was done in the groups on the tables, and sort of the types of answers we were looking for around efficiencies was the fact that we need to make them due to increasing demand, due to ageing, there's financial constraints, workforce pressures, innovation and value, sustainability, historical challenges of limited resources to deliver high quality care. So our approach at our trust is we've got a project management office who hold the ring around the governance and management processes when it comes to EIPs. We also have what we call cross-cutting steering groups, which manage efficiency programs that cut across our locality networks. So we spent some time talking about that as well. So sorry, on to you.
Oh, sorry, Ali, just go back. We missed the last bit of the second activity, I think, on that bit.
Oh, sorry, guys. Yeah, so the second activity, we discussed efficiency as you've been involved. Well, we asked them, what efficiency have you been involved in that you're proud of? To try and get them to talk about stuff that they've already been doing and sharing ideas. And then we asked each table was then given an efficiency theme, so like either estates, digital, staffing, and then the task was to come up with an efficiency that was linked to that scheme. Sorry to jump ahead.
So yeah, this is kind of where we got to the end of the session. So again, like I said at the start, we had flip charts around the room with post-it notes, and we just asked for any final suggestions on wall charts. We also had a list of HFMA modules that we could make available, and we asked them to kind of just add little stars to each of the ones that they felt would be most relevant or they would like to participate in. We also asked for suggestions on supplementary sessions that they would find useful, how they feel finance can help them, and also what they think would be relevant for future sessions at different levels. Like I said, this was kind of aimed at director of ops and associate director of ops, so quite high level, but obviously, you know, these sorts of techniques can be used right down to a team leader level where you might want to discuss, you know, how to read a budget statement or something like that. Ultimately, you know, we got really good feedback from this session from the senior management, and we did receive lots of positive responses. And ultimately, you know, I think making it a bit more fun and engaging hopefully makes them more invested in the process and happier to work with us as finance professionals. So that's a bit of an overview about how we made finance fun, or hopefully made it fun. Is there any questions from anyone?
Michaela?
Hiya. Yeah, thank you. This is really helpful because that's one area we struggle with budget holder training. I think pre-COVID we had quite a good setup, then COVID happened and obviously remote working, and it's been quite difficult to get back into a good kind of like, you know, new process. So I've seen that you do this face to face. Do you do any budget holder training remotely at all, or do you try and do everything face to face? Appreciate the positives of doing face to face training.
There is some elements that are still online. So as part of our organisation, sort of like leadership programs that they offer, there is kind of finance elements to them, which I believe are delivered online. But where it's our specific finance budget holder training, we do always try and do that face to face now, at that kind of senior level, especially.
And sorry, I appreciate this is a second question. Do you get good take up? Do you like a lot of people do join these, and how often do you do them? Are they monthly, quarterly? Yeah.
We got really good uptake with the directors of ops and associate directors of ops, but I think that came from a top level to sort of say this is kind of compulsory and you need to attend this. So that helped. We probably deliver them not super frequently, maybe biannually now. And for the service manager level, we did try and offer them in different geographical locations. Obviously, our trust spans a really large geographical patch, which is probably our biggest challenge. But we did offer kind of multiple sessions in different parts of the geography. We do always try and make sure it's room space that is free, or we already have in our organisation, just to limit the cost associated with that as well.
Yeah, we sometimes try and tag on to meetings that are already set up where they're all there and they can't leave. So that helps sometimes.
Good tactic.
Yeah.
Brilliant. Thank you very much.
Thank you. I can see Leslie's got a hand up.
Hiya, thanks for that, Ali and Lacey. That's really given me lots of food for thought and loads of ideas to go on. My first question was around attendance. How did you ensure that people actually attended? And you've already sort of answered that it was almost mandatory for your senior teams to come. My second question was this the whole day of learning that you booked out in people's calendars, or how long did these sessions last for?
I think
Obviously.
this one was around 3 hours, this training.
Okay. So it was
Yeah.
like a morning or an afternoon session that you
but
asked people to come to.
You could definitely do it, shorter, a couple of hours maybe for the service manager ones.
Yeah.
Don't know what you think, Ali. Is that about right?
Yeah, I mean, you can tailor it, can't you, to what you want them to focus on. But I think anything longer than 3 hours, people just switch off anyway, even no matter how fun you perceive it.
Yeah. Okay, thanks very much.
Thanks. I can see Ellen has also got a hand up.
Yeah, I just wanted to add my thanks. It's so interesting because normally those training sessions, when you deliver them, they're pretty downbeat, especially in the current financial environment. So it's so refreshing to think about, doing it in a way that, as you say, raises the energy and engagement levels. I just wonder, so we're looking at developing a modular approach and looking at, tailoring the content for different groups of staff. So as you say, service managers and budget holders will need different input to the director of ops sort of level. There's a group that I'm not sure were included in yours, of like clinical directors. So, clinicians who are involved in management. And I just wondered if you've done any training for them.
Yeah, so as part of our sort of senior managers, we do have sort of a clinical uptake within that. So we've got like a triumvirate where we have a medical and clinical ops lead as well as just the ops lead. But yeah, when we filter it down, we are going to do a specific one for medics, and I suppose the clinical side, all the budget holders, we do have clinical budget holders as well. So we do it for budget holders, really.
So that initial session that you ran for when you said directors of ops and associate directors of ops, would that have included the kind of triumvirate team from each service? So it would have included the clinical or medical director. Yeah. Okay. Thank you. It's really helpful to know.
Thank you. I'm going to bring Tom in.
Oh, yeah, thanks for that. I think you mentioned something earlier about giving the delegates some sort of pre-work to do coming into the session, which would then be used for some of the content in the session. I was wondering how you got people to actually get on board with that, because I was listening thinking, I don't think anybody I asked would actually do that.
I mean, we hope they did it, don't we, Ali? There was sort of some HFA modules, reading the board report, and a survey and a video to watch, I think, that we'd asked of them. It was coming from top down, so it was an exec request that all staff do this, which I think helped. Ali, I don't know if you had anything to add.
Yeah, I think we did start off the session acknowledging that not everybody may have done that pre-work, but it would have. You get out of what you put in, don't you? I suppose in these sessions, and they know that. So you can't force people, can you? But
was there anything that you guys did to sort of promote more uptake of it, other than the sort of pressure from above?
No, but that's a good advice for future. Perhaps we could do a bit more pestering.
Yeah, I mean, it was in their diaries for a long time, and there was, reminders beforehand, various things coming out beforehand. So they were kind of getting kind of regular reminders, I suppose, that it was coming.
Thanks.
Thanks, Tom. I'll bring in Pam and then I'll move to some of the questions in the chat.
Thanks, Natasha. Thanks, Lucy and Ali. That was really brilliant. It's so timely, your presentation, your showcase, because we're literally just relaunching our own budget holder training again, because we've been running it for about many years, ever since, been here last decade. But I think similar to other people that have spoken and yourselves, I think pre-COVID it was really running really well face to face, and I think during COVID we've moved virtual, and I think what's happened is our sessions have just become so long because we're trying to cover so much that we're just feeling the interest seems to wane. And so I think there was another colleague that spoke earlier. I think we're going for a modular approach so that we can target different user groups, like people that do ordering, those with budget holder responsibilities and things like that. I mean, I just wanted to ask you, because it was a top-down directive, and I like that, given the current financial climate. Do you kind of make this mandatory for anybody that has like a budget holder responsibility, or not, or is it just open to people that just want to learn more?
No, it is mandatory. We do keep a log of who's
Right.
attended and who hasn't.
That's really
With them
good.
being budget holders, it's
Yes.
it's their responsibility to make sure that they're up to date with the
Yeah, I
latest.
think we were looking at making it more mandatory in an official way, though. You know, through our
Like on
sort of like
ESR.
whatever platform we use to put our mandatory training. I think we were looking at putting something there where they'd have to book onto a session to make it a little bit more formal in that sense.
That's really helpful. Thank you so much for that. It's given us lots of really good ideas. So thank you. Well done.
Thank you.
Thanks, Pam. I'm going to just go to some questions in the chat before going to more hands up, because I think they're piling up in there. If I just scroll up, there was one which I'm not sure has been answered. Was this a one-off training session or part of a program you offer?
It's starting to become part of a program, so we're looking at disseminating it. We did it to our deputies within finance, so that then they can then learn how we're doing the new approach, and then they are disseminating that with our help to the lower banded managers. So yeah, we haven't done the full program yet, but we are sort of rolling it out.
Thank you. And then Joy asked, do you run any refresher sessions?
Yeah, so we will be doing refresher sessions going forward. We'll have to think about different games though, won't we?
Yeah.
Keep it fresh.
How many people do you do this for, and can it be scaled up or down, do you think?
Oh yeah, it definitely can.
Yeah.
I mean, we recently did a different session for just on business cases and went into a bit more detail, but we kind of used the same format, and that wasn't for as many people in the room, but it still worked well. I think so. You can scale it up and down depending on what you want to.
Yeah, I think we've had like up to 30 people maybe at once doing this training, something like that. 20, 30 people. So, but yeah, definitely can be scaled up or down.
Thank you both. Lauren asks, how do you find spreading it over different patches?
It is hard, but I think when we offer the training, we have all that set up to begin with. So these are all the sessions that we've got planned. These are the geographical locations. These are the dates. So then at least when we're putting that kind of request to attend out there is lots of options. It's not sort of like kind of trying to get some engagement and then putting the sessions out. So we do try and have all that organised before we put it out. But it is difficult, but it does work.
Thank you. And do you run any training sessions as part of the organisation introduction?
Probably not, because I suppose at that stage we wouldn't necessarily know who a budget holder is or who isn't. You know, if there's a new manager that's maybe a service manager, they would obviously meet with finance and we'd give them that little overview and introduction that way, and then they would just book on to the next training. But that's probably how it works so far at the moment.
Cool. And then I'm just going down. I think you've answered a few of them. If you were doing it for a group of service managers, what topics would you include or exclude?
Probably a lot of this similar stuff to what we covered here. You'd hope by the time someone's at a service manager, they would understand sort of budget statements, that type of thing. I don't know, Ali, is there anything you
Yeah, I
would add?
suppose, yeah, you'd maybe do a quick overview on budget statements, but won't linger on that. So yeah, I would say it would be like the higher end of things, a bit
Yeah.
more focusing on EIPs, cost efficiencies.
Maybe a little bit around sort of like purchase orders, invoices, that type of thing, just to make sure that they're closer to understanding those types of things as well.
Yeah, the governance processing.
Yeah.
There was also an add-on to that as well. Do you have a PPT or PDF budget management guidelines that you share with them, or something available on the intranet?
So we do have our budget holder support pack that when you become a budget holder, that gets shared automatically with budget holders, and they need to sign up to that each year and agree to everything that's included, which basically contains everything you'd need to know if you're a budget holder and where you can find all the information that you would need.
Thank you so much. Was there any other questions? I think someone did have their hand up, but I think they put it down, either in the chat box or with their hand raised. No, I think there's quite a few questions there. Thank you so much for joining us today and presenting on this. And thank you for everyone that contributed with their questions. This session has been recorded, so if you wanted to send it on to anyone within your organisation. Oh, sorry, Pam, did you want to come in? No, she was clapping. Yeah, we're putting it on our YouTube channel, so if you want to send it on to anyone or recap, then that'll be up on our YouTube for a resource. And are you happy for me to share slides with the delegates as well?
Yeah, sure.
Fabulous. Well, thank you again, and I'll give some people time back in their diary, and have a lovely day, everyone.
Oh, thank you for having us.
Thank you so much.
Thank you.
Bye.
Thanks. Bye.
Thank you.